So I'm just going to try to finish this segment. So every year we've got the flu. Right? So ultimately that is the kind of context, the larger context of what we're dealing with. Okay, so I wish you well. Oh, let me show you. So what I want to get to, then as I'm advocating for following Sweden and Singapore and so on, for quickly ending total quarantine based on and treating it as a public health education opportunity, as well as the actual epidemiological and demographic foundations that it has, and the role that it has in fighting the disease actually. But then understanding the larger context that is the important role in the lives of a population of the economic system, of the socioeconomic system, no matter how problematic it is and how much in need of reform it is. Like the United States versus social Europe and its many strengths, as shown in much of which is shown, or some of which is shown in Michael Moore's latest film, Who Do We Invade Next? And so then limiting the quarantine, the objective is to then develop a targeted policy like those countries, dealing with the most vulnerable, the high-risk groups, those who are 70 and older, particularly, especially, with pre-existing conditions, identifying who is infected, and maximizing sort of quarantine or quarantine-type issues there, and along with the medical alerts, the public health medical alerts, for the masks, for the hand washing, for the decontamination at the door when returning from the outside world, and then for the public health treatment, right? Using these resources, the resources that are saved then by not having to try to sustain things without the economy, using those resources to then fund building additional medical facilities and supporting those who are in the high-risk groups and the infected, right? And building additional facilities, building additional equipment, as I gave some reports, as I just gave from some of those reports. Okay, so, and then there's also this issue of the psychosomatic medicine and the spiritual life and the religious life, and those benefits to people at various levels. So, here is Dr. Alyssa Rankin telling a story about, in Italian. It's not starting up here. It's slow in responding.
Even more case studies in the medical literature was like that for me. It was like all of a sudden everything shifted, and I suddenly started thinking, what if it's possible that I could have a spontaneous remission? What if it's possible that you could have a spontaneous remission? And I was watching my patients do this by asking the question, what does my body need in order to heal, and then getting really brave. So one of the case studies that I came across was recently in the New York Times. This guy, Stomatis Moritis. So Stomatis Moritis was a Greek war veteran who came to the United States in the 1940s with a combat mangled arm. So they fixed his arm, he wound up getting a job in manual labor, and he married a Greek-American woman, settled down, had kids. And one day Stomatis was at work and he's getting really short of breath, so he goes to see the doctor, and the doctor tells him, you have terminal lung cancer. And basically tells him he's got 9 months to live. So they offered him aggressive treatment, but they said it's really not going to extend your life very much, and the side effects are going to be rough. So Stomatis decided, well, if I only have 9 months left, I'd rather skip the treatment, and I might as well save some money. I don't have a whole lot of money. I might as well save the money for my wife. So he and his wife decided to move back to his native Ikaria, a small island in Greece.
Okay, and guess what happens, right? The good life, the relaxation, has amazing benefits, and whatever, 40 years later, at age 98 or something, the guy is still going in the good life there in Greece, but representing a more relaxed life and lifestyle. So then I want to get to another testimony here. I mean, there are a bunch of testimonies. There's one that the series, It's Only a Miracle. No, It's a Miracle. It's a Miracle. Called The Healing Ritual, that shows the story of a guy that got sick while he was hiking, as it happened. He got sick, and it turns out he was experiencing liver failure. The doctors in Orlando, Florida, where he lives, couldn't explain it, and so they had no treatment, no notion of how to respond to it, except with the possibility of a liver transplant. But he was he was actually showing mental confusion, and so there was a lot of thought that the prognosis, they might not even get to the liver transplant, and that he might die. So his church, then his deacon, I think it is Deacon Paul, responded. It was the Episcopalian church, as it turns out. And so they actually have an international network. So the deacon organized a prayer around the guy's hospital bed. Bill Owen is the guy's name. And then sent word to their international network to basically ask for prayers. Now, I don't know if you've ever been to an Episcopalian service. I have. I've been to a lot. I like the calm, tranquil services, ornate and stuff. And it's a very staid and very ritualistic thing, not really a very personal thing. But in this case, they got around, they read a prayer from the Book of Common Prayer, following the Deacon Paul, and then it was done in the Episcopalian network, the prayers that were done there, and there was a beneficial response. There was a total healing response by Bill Owen as patient. He recovered completely. So it's a wonderful testimony associated with the prayer, the church prayer of his family, friends, and church. So a wonderful example of spiritual religious phenomenon there. And here's another one. John Vection healed by miracle prayer on the Christian Broadcast Network. And so I'll show you a little bit.
In the spring of 2013, Darren Reitnar started having pain in his lower left jaw.
Pain was actually excruciating to the point I couldn't even open my mouth at times. Really, it was hard to even eat, sleep, talk, really anything. It just made life miserable.
Darren visited a dentist who said his only option was to have surgery on a wisdom tooth.
I did not want to do it whatsoever. I tried different prescription pills and things that eased the pain, but it didn't cure it altogether.
In June of 2013, Darren was watching the 700 Club when Terry Mewson started praying.
Says I really feel the Lord's telling me someone's being healed in their lower jaw.
Someone else who had an infection in a wisdom tooth that's actually gone up into the bone in the jaw. God is completely healing that for you.
I didn't really even think of it at first, and I'm like, wait a minute, my jaw isn't hurting anymore, you know? That's when I realized that was for me. For me to have that, it was a very personal feel for me. It was like, you know, for someone, like I said, very far away down in Virginia, to have that, God telling them for me, you know, that was just an awesome experience.
Within days, all the pain left Darren's jaw.
I was blown away. I haven't had any problems with pain, not even so much as a twinkling of anything in it. It helps me, you know, knowing that God's there to heal. You know, I can tell others, it just encourages them, no matter how small or how great, and, you know, no matter what you're going through.
All right, so there's a shorty but a goodie, short and sweet, beauty of a personal testimony. 9 minutes. Okay, so closing down here, ending this segment. So, thanks, keep yourself healthy in the corona situation. See you.